Hi, my name is Joanna Parga, and I am an assistant professor of clinical pediatrics at the Children's Hospital of Philadelphia. In this module, we will be discussing the definitions of lung volumes and capacities. Your learning goals for this module are to be able to define and describe the different types of lung volumes and lung capacities. We will learn the relationships between these values and how to graphically represent them using normal respiratory curves. We will conclude with a discussion of the differences between neonatal and adult lung mechanics. Let's start by taking a few breaths. Lung volumes and capacities give us a way of measuring the volumes or potential volumes of air in the lungs over time during different phases of respiration. We will spend the majority of our lives participating in tidal breathing, which represents a relaxed state utilizing only a portion of available lung space. Periods of tidal breathing in our everyday lives are punctuated by deep inhalations and deep exhalations, which exercise the increased volumes and capacities our lungs are capable of. Once we review the definitions for lung volumes and capacities, we are going to return to this graph to understand their place in the respiratory cycle. The four types of lung volumes are listed here. Tidal breathing, or breathing at rest, is defined by the full volumes that we inhale and exhale without thinking, or our tidal volume. The inspiratory reserve volume is measured when a deep inhale is achieved and extra volume is placed in the lungs. The expiratory reserve volume is measured when a deep exhalation is taken and the lungs are forcefully emptied. As hard as we may try to exhale, we will never be able to fully evacuate the trapped air in our lungs. Since the volume in our lungs is never zero, the last volume we need to define is the residual volume, or the amount of air left in the lungs after a forceful exhalation. Returning to our breathing graph, you can see the various lung volumes outlined during inhalation and exhalation. Please take a moment and pause this recording to solidify these lung volume definitions. Lung capacities are determined by adding together the different volumes the lung is capable of. The inspiratory capacity of an individual represents the amount they normally breathe plus the amount they can inhale on top of their normal breaths. The tidal volume plus the inspiratory reserve volume. Alternatively, the functional residual capacity is the amount of time that a person is capable of exhaling plus the amount of air they always have present in the lung. The expiratory reserve volume plus the residual volume. You can think of the vital capacity as the maximum capacity an individual has to inflate and deflate their lungs, or the sum of their normal breathing patterns, plus their greatest inhalations and exhalations. Lastly, the total lung capacity isn't just a person's vital capacity, but also includes the residual air that is always present in the lungs. Since total lung capacity includes the word total, think of it as a sum of all the respiratory volumes combined. If we return to our breathing graph, we can see all the volumes and capacities outlined and their relationships to one another. It is important to know these values in the context of a normal, healthy respiratory cycle, as they change during different lung disease states. Please pause the recording to solidify these additional definitions for lung capacities. While the definitions of lung volumes and capacities apply to both pediatric and adult populations, these values vary greatly with age. In general, neonates take quick, small breaths. This leaves them with high respiratory rates, minute ventilation, and alveolar ventilation compared to adults. Since infants do not consciously take large inhalations and exhalations and have smaller, more resistant airways, the only volume that is increased in this population is the residual volume. In contrast, adults are able to take slow, large breaths that increase the volume moving through their lungs. Therefore, the tidal volume and most capacities are higher for adults. A summary of these differences and similarities for respiratory measurements in neonates and adults is shown in this table. In this module, we defined lung volumes and lung capacities and looked at how these relate to breathing in a healthy human. We also compared and contrasted respiratory measurements in neonates and adults. In the second module, we will discuss unique features of infant lung volumes and capacities, and how these values change in relation to lung disease states.
We would like to acknowledge the American Academy of Pediatrics, the Organization of Neonatology Training Program Directors, Neo Reviews, and Abbott Nutrition for their support of this educational program. This concludes this module.